Hi, everybody. Good evening. Welcome to our second live broadcast here for the Caregiver Political Education Boot Camp. We are in week two. Yay. So tonight we're going to be talking about important things. Oh, no. I'm getting myself feedback. Hold on. I can hear myself. So well, I'm going to give myself a pause and deal with this. Oops. Okay, I think that should stop the feedback. And give me 1 second. So as we get more technologically engaged here, we got a mic this time. I was getting feedback because I had the mic on, and then have headphones in. So please bear with me as I, learn more about how to do this live streaming situation here and recording. So welcome everybody. I'm very, very excited about tonight. I'm just introducing the topic. We're unpacking public policy of DC school-based behavioral health system. We're going to be on here till 7:30, maybe just a few minutes because we're starting a few minutes after 7:30, just because we're starting late. And I know we're going to have power-packed dialogue with a number of people that I'm going to introduce a little bit later on. So again, the Caregiver Political Education Boot Camp is an initiative of the DC Child Justice Coalition. We exist to promote political education for disability self-advocates and caregiver self-advocates, and of course the intersection between the two. Disabled caregivers are our number one priority, and we know that caregiving is about reciprocity. So you give care, you get care, but in any case, we all deserve a high quality life and a high level of life. The DC Child Justice Coalition is comprised of a few organizations. We are a growing coalition. We're just building in real time and would really love for more participation from community. Currently, we have contributions from Ward 6, Serve Your City Mutual Aid Network. We also have support from Black Swan Academy and the Police Free Schools Coalition. So interlooping that work, and we'll be very excited to be having a central conversation on police free schools in a few weeks, and more on that later on. And we'll be having, we are also in partnership with Advocates for Justice and Education, the DC Premier Parent Information, Parent Training Information Center, and of course, FixPat, which is my nonprofit, the nonprofit I'm a part of, and we support neurodivergent pregnant people and disabled families with children up to the age of 8. We take caregiving support seriously, and we provide mutual aid support via our incubating cooperative, Neuro Mama. So just getting in tonight, last week we introduced the concept of carceral logic, also the discriminatory refrigerator mother theory, which basically says that the mother is cold, and when the mother is cold, that is why children are disabled, and that's why they should be removed from the home. And that was typically what happened before 1975 when we passed our special education laws, and the Individuals with Disabilities Education Act. And we know that theory continues to inform the family policing systems, how parents are seen as problems and not part of solutions or even experts in the lives of our children. And we're here to combat that myth and bias. And so much of that lends to carceral logic, which was our central theme, right? Carceral logic. And we'll keep deepening, carceral logic as a concept. And so we also are engaged in dialogue tonight with some of well, before we talked with our past caregiver participants from the 22 political education boot camp, and our two current members of this year's boot camp, and members of the Acoma Project report team. And we look forward to launching that in May later on this year. So stay tuned for that. And tonight we are unpacking the DC law that governs the school-based mental health, which we have a lot of faith and hopes that it would be something that will actually be a benefit and an asset to our families. But we know that there are carceral traps in the implementation of that policy, and that's what the Acoma Project report is all about in any case. And we're just unpacking it with some friends as we go live here tonight. This is our central theme. This is the first time we're going to do a deeper dive into that, and we'll continue to do that for the next 10 weeks for this cohort boot camp. And we'll be joined by two other caregivers of this year's cohort, and other guests who are knowledgeable people of the caregiver of the South Capitol Street Memorial Act. Waiting on some people to roll in, so we'll just roll on as people come in. But in the interest of time, I really want to celebrate the caregiver that is here. Well, before I get to that, I want to talk just a little bit about public policy as our little political education thinking, what's kind of guiding us right now. Public policy can be generally defined as a system of laws, regulatory measures, courses of action, and funding priorities concerning a given topic promulgated by a governmental entity or its representatives. And so we know that public policy is a word that's used a lot in many different arenas. For community members who may not have the opportunity to unpack what that means if you're not intimately involved. So I see we are, a lot of our caregivers are in the boot camp are part of the audience tonight. So, hi, Renee. Renee joined us the last time, and I look forward to, pulling up questions in the chat. So please, whatever streaming that you're on, we're on LinkedIn, we're on Twitter, we're on YouTube, we're on Facebook. We are on, I think that's it. Facebook, Twitter, LinkedIn, and YouTube. And we will be taking comments. So if you have any questions or comments that you want to ask, please put in the chat. No matter what streaming the service that you're using to catch this right now, we'll be able to pull your questions up. But this is a theme. Public policy is what we are trying to impact. Public policy is a place that, is filled with a lot of class privilege. We know that many, I'm just going to take this off and just talk for a little bit. We know that many caregivers in the community, especially Black and Brown, disabled folk, immigrant folk, are not well versed in public policy, are not part of the culture, may not necessarily know the rules of how bills become a law, right? I love I forget that cartoon from when we were kids that would talk about how a bill becomes a law. It's available on YouTube. If I find it, if anyone finds it and wants to put it in the chat, Schoolhouse Rock, I think it is. But we know that public policy is really important in our lives. Public policy shapes our lives. Public policy is the vehicle in which our legislative branch of government primarily drives the agenda for, and it it shapes what we do, how we live, where we live. It shapes what schools and the quality of the schools and what happens in the schools that we go to and attend to federally and locally, and statewide for those who are in different states. We're in Washington, D.C., so we are, a city without a state. Go figure. And but in terms when it comes to education and healthcare, particularly, we are considered a state. So there are many different systems, many different types of governmental systems that public policy impacts. Um, we know that the people who are most negatively impacted by public policy are Black, Brown, disabled people, immigrant folk, and otherwise marginalized LGBTQ, queer people. Any marginalized identity can find itself in a very disempowered place if your needs are not well articulated in public policy. So it's really important that we understand what it is, why it is, and how it works. And so we hope to, contribute to helping create more public spaces. So our boot camp meets privately on Mondays because it's important we create intimate, safer space for us. Okay. Yeah, I think that's at Schoolhouse Rock. Thank you, Teresa. People who may want to pull that up and see, how a bill becomes a law. I think that's what that is. I hope that's what that is, Teresa. Please clarify if you were posting something else. But, in any case, we have a lot to unpack specifically about one particular public policy we're dealing with today, but we know that there's so many public policies that we're facing that are negatively impacting. We're going to get into the news segment a little bit and the hashtag Hands Off DC movement, which, I 100% support. And I know that many others in the cohort and in the coalition also support. And what it has to do with public policy, we'll talk about it in just a little bit. But for now, I want to bring on another thought leader here that's going to help unpack some of these ideas and probe and think with me as we continue. So as we wait for Mama Joe, where you at? I'm going to bring on Salonda. But before I bring Salonda on, I'm just going to share this to just give a bio. I'm going to introduce Mama Joe as well. So these are two more caregivers that are part of our cohort. Salonda Thomas, is a wife of 30 years, mother of two, and former preschool teacher, left the job to homeschool her oldest child who has dyslexia, was a DCPS student at the time, and lacked adequate services. Her youngest child is now 21, is autistic or has autistic tendencies, attends St. Coletta's here in DC, which unfortunately oversight hearings showed that the school is potentially facing closure. So maybe we'll get into that a little bit, Salonda. And I've heard so many great things about Salonda even before I had the honor and pleasure of meeting her as one of our OG, just really dedicated, caregiver advocates out here that have paved the way for so many others. So I feel honored for her to be part of this cohort and to be in dialogue with us tonight. And also Mama Joe, another veteran here, and hopefully will join us on the live stream tonight, but has included other important people. We have Reverend Anthony, who is going to be joining us later on to talk a bit about the South Capitol Street Act. And Mama Joe was very instrumental also in the passage of that law. So Mama Joe is a pioneer advocate for policy, systems change, justice, special education, juvenile justice, mental health, ensuring that family-friendly systems and fair due process exists for parents. She's the founder of Parent Watch Incorporated, which is a family family run organization, family centered organization. She's very active with the DC Department of Behavioral Health and so many other systems. Also has relationships with Department of Youth Rehabilitation Services, which is a key carceral system that we also hope to impact through this process, and the families and our children that are navigating, our children and youth that are navigating that system. So enough of that. And I want to bring Salonda on here to share with us in her thoughts, in her own words. And sorry, Nina. Nina is helping with background with the slides, but I am just such a control freak. I'm just doing it. So Nina, I apologize. I'm gonna turn it over to you now. So I'll tell you when I want you to pull up the slides, and we can go to. I'll tell you which slide number we're gonna go. We're gonna skip to slide number 8, just so you know, Nina. Heads up. But Salonda, welcome.
Thank you for having me.
Thank
So,
you.
as shared earlier, I've been married for 30 years. This coming December, I have 2 young males. My oldest is 25. He has dyslexia, and as stated, I end up homeschooling him because of his disability. And my youngest has Down syndrome with autistic tendencies, and he wasn't in St. Coletta, but I pulled him out in St. Coletta. So first, I'm going to begin with my oldest son. The thing about my oldest son was I had him in the school within the school, kind of like if you know that part of the Capitol Hills, like you start at school with the school, then you feed into another school, and then you feed into Stuart Hobbs. So I had him in that thinking that this would be a great, great time, great education, because where I lived, the schools weren't as, up to date with the things I wanted to teach my son at the time. So I get him into school within a school. And then at the time I was also teaching. So then I had my son, my youngest. So I pulled out of teaching to be home with my youngest because of his disability and having to take him to services. Well, while I'm having to take my youngest to services through early intervention, my oldest started having issues in school. He would see words and then have issues with them later on as if he'd never seen the words before. And so, we fought through it, trying to get him help in the schools. And then one day, he's on the playground and his teacher collapsed and she dies in front of the whole class. It was several classes out there in the playground. So she collapsed and died in front of all the students on the playground. So I pick him up because, we all get an alert that they want us to come pick our kids up. So I get to school and, they're just telling us, pick your children up, take them home. We're going to have someone come and talk to them later on this week, and we'll notify you when we have someone come in. And so the parents are not really aware as what's going on. We know that something's happened with this teacher, but we don't know the details of it. So when I get home, I sit my son down, who is like, he's in a kind of like a dazed situation and very fearful and don't want me to leave and go places. So I'm sitting him down. I ask him what happened. He tells me that his teacher was telling one of the students to get in line. This student happens to have a disability. He was an alcohol fetal syndrome student, so he was always all over the place. And so he was that student that everyone knew would get into trouble. So in their minds, the teacher was telling the student to get in line, and because she was yelling at the student above the other students to get in line, she ends up collapsing. So of course, the little boy who the teacher was yelling at gets blamed for the teacher collapsing. So as I dove further into what happened on the playground, my son tells me that his teacher passed out, that another teacher and someone else on the staff ran into the school to get the machine, which was a defibrillator. And they had it and was trying to get her, heart to start back up. And then eventually her face turned blue and her lips turned blue. And I was kind of surprised because none of the adults thought to take the kids into the school at this point when the teacher, collapsed, because it's one thing to see a teacher collapse, but then it's another day to actually see her die in front of you, like standing, you're standing beside her body and you see her turn blue and her lips turn blue. And then someone thought at that point to take the kids into the cafeteria. The ambulance shows up and they take her away. And then the following day at school, we found out that she had passed away. And we were promised that someone would come in to talk to the students about what happened to help them to adjust. but that never happened. And for the longest time, my son had issues with sleeping. He had like separation anxieties, and these are things that I had to figure out what to do on my own because the school had failed me. And so also around that same time is when I found out that he had dyslexia as well, because of the issues he was having. We thought the attention issue he was having was because of what happened with the teacher. But then we realized, no, this is more than just him not being able to concentrate. He's literally not recognizing words that he's been introduced to before. And then that's when I fought to have him tested, because when I wanted to have him tested, what I was told was, well, him being an African American male, we don't want him to be labeled too early. And that was not my process. My thought was, if he does have an issue, let's get it early and deal with it. So I fought for almost a year to get my son tested. The principal felt like it wouldn't be a good thing. I went and talked to who I was supposed to talk to in each of the schools, on each level. Like, who do I need to talk to now about the testing? And no one wanted to test. And I think it was more so an issue with money and them not wanting to pay for the testing. So eventually I got frustrated. I ended up pulling him out, get him tested on my own. And that's when I found out he was dyslexic. And then through this whole thing of finding out that he was dyslexic, I pulled him out. I started homeschooling. And with homeschooling, I started giving him services like Linda Moon Bell, Orton Gillingham. And mind you, none of these services are cheap. Like Linda Moon Bell is like $23,000. Orton Gillingham, I lucked up and got that for free because a lady that was tutoring him at the time at Orton Gillingham said she was teaching some teachers in Howard County for the summertime, and how would I be able to join? And she would let me take the course for free. So I jumped on that. And so then I learned how to teach Orton Gillingham, which I used throughout his homeschooling career. But like I said, my husband, I spent most of our own money trying to meet his needs, making sure he had the proper education. But in the long run, me taking him out to homeschool him probably was the best thing, because I was able to cater the curriculum towards his learning style, and also help him understand his weaknesses and help him to see his strength. Because I felt like keeping him in DCPS, he wouldn't have had that same opportunity. He would have been regulated to the side. He would have been labeled as someone who has a failure to thrive. And that is something, if you see my son now, you would never know that of his journey, that he struggled so much, because he graduated this past May from UDC, magna cum laude, biology major. So so my husband's like, I don't understand why he's in biology. I can't help him if he needs help with biology. I was like, well, this is his passion, and this is how he learns. And so when he graduated, I think he even surprised himself that he was graduating with honors. So his journey is something that when I look back, all the naysays and just all the tears I cried, because it was a lot of tears, because he needed services. And because I pulled him out of school, DCPS was like, we can give him services, but then you'd have to put him back in school, or we could give him services, but it would only be this or that. And then around this time, they started to get other parents that wanted to homeschool. And I hate to say it, the only way we got homeschooling laws is because non-brown and Black people started complaining about the homeschooling situation in DC. And so once they started complaining, then we started seeing things being moved where you actually had a homeschool part of DCPS, where you could actually go in and put your intent to homeschool. And then you may talk about the services you might need. But by this time, I had already done what I could. I was like, I'm not going to do all the other stuff. I will put in my intent, but I'm not going to worry about the services, because I've already got him on the right path of getting the services he needs. And I myself was at this time doing the Orton Gillingham with him, and then making sure he did all the other things. Like, I put him into NSBE, the National, Society for Black Engineers. I put him into AXO. Yeah, I put him in AXO so he could compete every year with students from different states in the sciences and entrepreneurs. So I put him in a lot of things that would substitute for what he wasn't getting in school. I put him in basketball. I put him in fencing. I had him, just doing things that I knew that, because he's homeschooled, I wanted to make sure that he got the opportunity to be, a student, a true student, and enjoy his learning style and enjoy other kids. Then with my youngest, along with homeschooling with my youngest, I was fighting the system to get him the adequate services. He was at Barnard Elementary School at one time, and the speech pathologist had went on maternity leave, and no one thought to tell me that my youngest was not getting speech therapy for 6 months, which was
Oh my
part of
God.
his IEP. So then I had to fight to get that retro, to get the comp services. And then the summertime comes up, so you can't make up all the time that he missed during school in a
No.
summertime. And so then I'm going back to having to get lawyers to talk on my behalf to DCPS about what I needed. And then around that time, I also got invited to be on a federal panel where I was participating with PACE, and then being the only parent in
Mhm.
the room, being able to go down for OSSI to North Carolina to different conferences
Oh
and giving my
wow.
input on the laws and what I thought needed to be put into the new IDEA law that was coming out at the time where they were revamping it. So I had the opportunity to be able to sit at the table to talk to the people who were going to make those decisions and let them see from a parent point of view that the things you have implemented is not really working. It sounds good, but when you put it on paper, that's one thing, but when you have to live it, it's another thing. So for me, I think living in DC and having to deal with DCPS, there are a lot of things that I think could have been improved. There are a lot of things that did work, and then there's some things that did not work. And with my youngest, I had pulled him out this past July because I felt like the services at St. Coletta was inadequate. And so I graduated him
Mhm.
in July. And so now I'm getting outside services done for him as well, because I feel like, again, there are a lot of things that was on his IAP that did not did not work for him, or they weren't
Mhm.
really for him. A lot of stuff you could tell was paste and cut, paste and cut. There are times where I found someone else's name on my son's IEP, and it's been kind
Oh
of
yes, I've
disappointing.
seen that too. Cut and
Being
paste. Yep.
disappointed that they went up with the LEA that represents DCPS at St. Coletta to say, hey, this is not even my son's name. I don't even know
Right.
these goals are even sufficient for my child. So, but yeah, it's been a long journey, but I think in the long run, my story I'm hoping will help someone else, and that I can be
Yeah.
a resource for another parent who may, so they don't have to go through the same journey I went through. They're going to have a journey because we all are, but hopefully it won't be as hard because I've laid the foundation and the road work that it would be easier for them, especially if you think about pulling your child out of school and homeschooling. There are a lot of resources that we just don't know about. A lot of colleges are
Yeah.
friendly to homeschoolers. Yeah.
I really want to get, I think we need another time to do deeper, like how to do that, how to
Yeah.
liberate your children from the school system and homeschool
Yeah.
them if that is your choice. I believe very much
Yeah.
in school choice, that we can choose for our children to be in whatever environments that suit us or that suit their needs, right?
Hmm.
And so, I have no loyalty to any school that is not educating my children or any of
Right.
all of our children. And we should have that choice to opt out when we are just not getting what we need. And I mean,
Right.
you're courageous is another, amazing mom out here that's homeschooling. Shout out to Shanta Jones. I don't know
Yeah.
if you know Shanta.
Yeah,
But
I do.
there seems to be, quite a number of moms raising children with disabilities that are making that choice, that I think we
Hmm.
we we do need to talk about the how to's, like how do you do that? I mean, I'm
Yeah.
that's for me too. I want to consider, like, what could that possibly mean, especially as I'm getting some teenagers now, and I really want them to have a good life. I want a victorious story like you do, and I want to keep this in your mind. And as we go through the cohort later in the year, we're going to do another cohort for Neuromama. This is through my nonprofit, FixPad, and
Hmm.
we're going to focus a lot on the building up like a care system, a peer-led care system, for us as caregivers. And literacy is a big part of that. And we want to
Yeah.
start reading circles, and learning circles, and take political education to the reading. I mean, you know that in this cohort, we are giving people the opportunity to sharpen their public reading, but it's not to shame anybody who isn't great at reading. We know that many
Right.
parents and caregivers don't read also, right? Or have low literacy skills as well, and should have safe, non-judgmental ways to build their skills, and may have unidentified learning disability. Shout out to Decoding Dyslexia. I don't know if you're connected with Decoding Dyslexia, but
Yeah.
that journey is so deep, and I just really want to contribute in some way, in a care loving, non-judgmental way, to support our knowledge and our ability to get even stronger. So what do you think of that? And have you supported other people? I know you're an educator yourself. Do you teach people to read?
I funny that you asked, because at a time when I first started with my son using the Orton Gillingham, I actually was teaching some kids at the rec near me, Orton Gillingham, and their teachers were coming down like, "What are you doing?" Because now these boys are paying attention in class. I had one teacher come in and was like, "Whatever you're doing, please don't stop, because he is paying attention." She's like, I could never get him to participate in class. He would just fool around, but now he has a confidence and he's participating in class. So I did that for maybe 2 years, and then I ended up stopping because the rec director changed, and it got very political. It was like, well, if you're gonna do it, you need to charge. And I was like, well, I was doing it for free, but I guess a lot of the things they did at the rec center, they were charging, and so she wanted me to
Mm,
start charging, and I was like, but I don't need to charge. It doesn't need to be charged, but that's how they were making their money. And so once I
that's
realized that they
interesting.
wanted, right, once I realized that they wanted me to have a course so that they could charge for them to make the money, I was like, nah, I'll, I'll, I'll step aside. And I did, which was sad, because those same boys, I see them now, and it's like, I know their life would be different had
Yeah.
the right adults interfered and wanted to actually help instead of making things harder.
Got it. Well, thank you so
Yeah.
much. And we're gonna pull up some other people up here. Mama
One more
Joe's here.
thing.
Hey, Mom. Oh, sure. Go
One
ahead.
more thing. In the midst of me homeschooling and all this stuff in 2011, I ended up having surgery for brain tumor. And so I had to learn to walk and talk again in the midst of trying to homeschool at the same time. And
Oh
I had
my
friends, I had
goodness.
mothers, other mothers who were homeschooled, who stepped in for me. So it is important to have a tribe. They stepped in for me for a while I was recovering from my brain tumor and learning to walk and talk again, and to homeschool
Oh
my
my
son. So,
gosh. Yeah, let's
you
talk
know,
about the tribe. I mean, oh my gosh. I want to pull in so Nina, I know I said that we're going to play the video. In the interest of time, I just remember that Reverend Anthony has to transition out at 7. So Nina, we're going to do the news segment last. And I'm just going to pull in Mama Joe and Reverend Anthony, and let's just keep talking about this village concept, right? It absolutely does take a village, um, uh, to survive, not even just to raise a child, to survive. And that's the mission here, right? Like, we know that public policy is a place that we that feels at distance, but it should be the rules of engagement. I want us to think about it as the rules of engagement, and that, a well system, a non-judgment, a decarceral system, a decolonized system is one in which, the journey that you just mentioned in terms of having a brain tumor, the impact and the trauma that it has on the children, the whole entire family, what it does to your ability to just feel that you can mother and caregive and do the things unto the people that matter, and emotionally how you cope, it really matters. And I want to introduce Reverend Anthony Motley, and Mama Joe. I want to keep talking about this, but I want to center them in dialogue. But I want to lay this up in a certain way, where we're going to talk about the South Capitol Street Memorial Act. So, Nina, can you pull up slide 8? Let me just talk a bit about the act and pull it on the screen. Okay, so the South Capitol Street Memorial Act there's a central theme of the Acoma Project report, in which we're unpacking during these 10 weeks of the Caregiver Political Education Boot Camp. It was introduced on March 30th, 2011, and it became law in 2012. It happened almost exactly a year after a devastating murder in South Capitol Street. This image that we see here is an image of Councilmember David Catania and Nardine Jeffries, who is the mother of Brichelle Jones, the youngest victim on that tragic event. Next slide, Nina. There were three other people that died that day, and I just want to say their names. So we have William Jones III, who was 19 years old, 18-year-old Devon Boyd, and an 18-year-old. How did I write this here? So I guess, sorry, it was four people. So we have 19-year-old William Jones, 18-year-old Devon Boyd, 18-year-old Tavon Nelson, and 16-year-old Brichelle Jones, of which Nardine Jeffries was Brichelle's mom, or is Brichelle's mom. The events happened, unfortunately, over a bracelet, a missing bracelet, right? And this is part of, why we need well systems. How, when I have a clinical diagnosis of PTSD, and that means that, when bad things happen, it can be possible that I'm going to draw back on that past trauma if I'm not managing my symptoms and I'm not aware of my triggering things that trigger me. Like, it's not the missing bracelet, it's whatever the missing bracelet triggered. And if I'm dysregulated and I don't know how to regulate, then that's going to spiral into acts of violence. I mean, that's just the reality of who we are as human beings. And our children and our youth are they're even, they have less tools to be able to regulate emotions, to understand the consequences of their actions, and they need every support with love, and disciplined action, to be able to be able to exist happily and have fruitful quality futures, and have that village that Solanda's talk about. Like, we all deserve that village, and that village to be a well village. So this is a quote from Catania that says that the product of Ms. Jeffries and his effort in the South Capitol Street Memorial Act of 2012 passed unanimously by DC Council on March 20th. That was the March 20th, which is my birthday. I knew my birthday was some instrumental day. The act creates a comprehensive youth behavioral health infrastructure in the district. The act, okay, Mama Joe, I'm coming to you right now, in a few minutes. The act will transform how the district addresses youth behavioral health issues, strengthen our ability to identify signs of unmet behavioral health needs early, and allow us to effectively intervene to prevent future outcomes. Nina, please, can you take that screen off and we can just talk out the rest of this here. So, our goal in the Como Project is to decarcerate. And by that, we mean, actually, sorry, Nina, there's one more slide. Can you go to slide 10? And we're going to end on that slide. Sorry, next slide. Okay, so carceral logic references a punishment mindset on reasoning assessed according to strict principles or beliefs about crime, criminality, prisons, prisoners, and other institutions that also restrict human liberty with the stated intention of correcting behavior in some way. Carceral logic is pervasive in government systems and is not limited to criminal justice functions. When it comes to schools, carceral logic targets multiple stakeholders, the most valuable being Black, brown, poor, disabled, immigrant, and queer students and their families. The concept of the school to prison pipeline is the the most notable aspect of how carceral logic applies in school culture and policy making, which in turn speaks specifically to the interconnection between criminalizing functions in schools that involve a number of punishment oriented functions: detention, in and out of school suspensions, truancy action steps, seclusions, restraints. We know the list that Solanda is now homeschooling, all of that, right? Like that model, that models the types of treatment prisoners face within prison walls, specific ways to address behavior challenges in schools. The act passed into law with a progressive vision to provide preventative and early intervention, um, yet does so without any penalty to decarcerate or decolonize. Please take off the slide. That's our thoughts on that law. But I say that critically with love, because I'm also committed to implementing the school-based mental health program. And I thank you so much, Reverend Anthony Motley, for being one of the architects, those who pushed it, and want to hear more about your story. Mama Joe, I know you're off camera, so I'm just gonna go straight to Reverend Anthony. And when you're ready, let me know, Mama Joe, to join the dialogue here. So Reverend Motley, welcome. Do you mind telling us a bit about yourself? I'm so sorry I didn't get the your bio in time to kind of add it into our slides here. So I apologize. Can you please say a little bit about yourself and tell us a story as to how you became part of helping to pass the South Capitol Street Memorial Act?
Yeah, good evening, everyone. Thank you for this invitation. Thank you, Mama Joe, and the young lady, the mother who advocated for her son. You are a treasure. I want to thank you so much. Um, I am a graduate of Anacostia High School here in Washington, D.C., product of Southeast. I'm also a veteran of the military, 4 years as a paratrooper with the 82nd and the 101st Airborne. I'm a combat engineer by training, but I'm also part of the streets of Southeast. By the time I was 13, two of my classmates were killed. I was 13. Um, so I watched, and I was present when another one of my classmates was shot right on 18th Street, and was shot by one of our friends. I think we were like 15, 14 or 15. So I grew up in that environment. It was the military that saved my butt, because if I had stayed in the streets, I'd probably be either dead or incarcerated. And so I went in the military. I was 19, and my mother and my grandmother, they all prayed for me, and I was able to successfully transition from military to becoming a veteran. So now I'm a veteran. I came out of the military in '73. So I've also I received a presidential appointment. I worked with the White House as a Schedule C appointee, and I traveled around the country helping the military, helping the White House to implement community-based programs around issues of self-sufficiency, especially when President Reagan was challenging welfare mothers and fathers to get off the welfare rolls and get a job. And so we had to go into the cities and to the neighborhoods and educate and empower the families. I traveled with a young lady over there in what was it, Kenilworth, Kimmy Gray. Kimmy Gray and I traveled around. We met with a young lady out in St. Louis. I think her name was I forgot her name now. But we traveled to different cities talking to the communities and public housing and in the neighborhoods, and talking to the uh, pop and mom pop shops, where grandmothers were taking care of community people. And so that was one of the things that we did. Also, um, I have a degree from the University of Detroit in communications. When I left the military, I went from being an engineer to a communication specialist. And so I went to Panama, where I was stationed, and we built strategic communications infrastructure. And so when I got out of the military, I went to school and I got a degree in electronic media, radio, and television. And then I came back home and I was able to help to design the cable television system for the District of Columbia.
Oh
And
wow.
in doing that, yeah, and one of the things I did was we traveled around the country talking to Black communities about cable television and the impact and the power of cable television in the Black community. So we did that, and I did that. And thank Marion Barry. Marion Barry nominated me to be on that commission, and also work with Bob Johnson of BET, and all of us worked together to make that happen. Um, I've also worked with Jesse Jackson, Rainbow Push up in Chicago. We supported the communities there in terms of electronic media, cable television. So I did a lot of that, and then I started doing some social. Marion called me a social engineer. I told Marion, I said, Marion, I'm not a social engineer. I'm a social entrepreneur. I go out
Yes.
and I try to figure out, how do we make things better? What do we
Mm,
do to make things better? And that's how Mama Joe and I, we did a lot of work together like that, dealing with the stuff that was happening at DYRS back in the day. And
mm,
they had some challenges. And so we worked together to try to make things better. And in doing that, I ran across a lot of people. I worked with the chaplains in the different institutions at Oak Hill, which later became New Beginnings. I worked, that was Reverend Evan Cole. Worked with
mm,
the Lorton community, the Lorton over in Lorton. Dealt with some DC jail, and doing all
mm,
of that as a person who I was trying to establish what I would call empowerment centers, where we actually built, for example, the Academy in Construction and Design that later became part of Cardoza, and then later became Ideal Public Charter School, where we taught
mm,
kids about construction, engineering, architectural
mm,
design, electrical systems, HVAC. So I started doing that, and that was a blessing. Um, and so I'm still now trying to get an understanding. I became a minister. I went to Howard, got a degree from Howard
Thank
as
you.
I'm a MDiv, or the big HU. Um,
No?
I got my MDiv from Howard, and worked with a lot of profound professors. Like I had was Courtwright Davis, and dealt with and I forgot his name, John Eubanks. He was my professor of mysticism,
Mm,
East and West. And
mm,
so, I did my internship at Howard. I did my internship at Covenant Baptist Church in South Capitol, on South Capitol Street, Southwest, and that's where I began to see the need for pastoral interventions at the local level. That we had to come out of the church, not just wait for people to come to the church. We had to go to where the people were, and we
mm,
had to give the people the tools. And so what my first thing that I did was, I don't know if you're familiar, a community called Valley Green. So Valley Green over in Southeast, um, it was notorious. And one of the first things I did was I set up a Bible study in that community. I got a
Mm,
grandmother, and she said to me, she said, if you want to do this, because I was telling her what my work, my internship was at Covenant. And she said, well, if you want to do that, you can use my place for Bible study. And so I started a Bible study in her apartment, bringing her children, the other children, and these were young people. These were teenagers and young adults who were participating. And
mm,
so that's where I started that community based pastoral work. And then we began to see the issue of violence, and how the
mm,
violence, I mean, it was just taking control. The
mm,
drugs, the crack, all of that was happening kind of like simultaneously. And then that was like, we talking 86, 87, 88, 89. We had the high incidences of violence. I was going
mm,
out at night with the young people, to stop the violence, as well as responding to shootings. You know, saying prayers of people as they're dying on the street. Um,
mm,
you know, one kid called me and told me, he said, Rev, he said, I just shot somebody. Can you come to where I am? And I had to
mm,
go to him where he was. He had the gun. He had shot the guy, killed the guy, and we waited for the police to come. And so I started learning certain things, about that experience. So
mm,
I started working with some of the schools like Hart Middle School, Ballou High School, and created conflict resolution and peer mediation. And then later we created a youth court, and
mm,
we based the youth court. We based it at one of the churches, but we did the peer mediation and conflict resolution at the middle school and at the high school. And we found out that one of the high schools, I mean, excuse me, one of the middle school, they had a psychologist in
mm,
on the staff, and she was there. I forgot her name now, but she was a white woman, and she was attempting to provide um, psychological support to young people, young men and women, young girls, boys at the middle school level. And she was having some problems because she had some cultural challenges. And
mm,
so she allowed me to come in and to be like a partner with her in doing those kinds of what we call didactic experiences. And then we moved over to Baloo, and we did the same thing with Baloo, and it was a very good partnership. She was this
mm,
as the psychologist, myself as a pastoral minister, and so we did all of that during that period of time of bringing the homicides down. Well, and remember now, this is 89, 88, 89. We had 489 homicides in 1 year. 400 in DC.
I remember
Remember
what
we were
89
called.
was like. Yeah.
You remember we were called
I,
the capital, the murder of the nation.
yep.
Well,
I remember.
um,
I remember. I
remember,
mean, I was a child, but I definitely
yeah,
remember being called the capital, you know.
yeah, yeah. And so what we said was, look, wait a minute, we got to do better than this. We can't have
Yeah.
this. And so we began to have some programs and activities. We did the midnight basketball. We
Mm,
did that along with our police department, and we
mm,
didn't have no grants. We didn't have no grants. We didn't have no contracts. We just went and did
mm,
it, utilizing the resources that we had. And one of the things we found when we did the midnight basketball was that we did it from Thursday to Saturday, from 8 to midnight, sometimes 1 and 2 o'clock in the morning, bringing
Mm.
teams from all over the city, mostly from the streets, not even organized, but just wanted to play some basketball. Brought the
Mm.
roving leaders, had MPD in there, and then the commander over at 7D, he said, you know what, we need some resources in here. He said, so if we're bringing all these people in, they come in, the families are coming to watch the basketball, the players are playing. He said, we need some resources. So we brought in DCPS, we brought in the rec center people, we brought in all these, we had some health issues, the health department of health there, Department of Health, Human Services was there during that time so that we could
Mm.
provide support to the community. Well, we did that and it was very successful.
Mm.
And then politics got involved in it.
Mm.
Good thing they just won't let things go. They want to, the politicians want to come in and change it when it's working. You know why? Because
Mm.
it's not theirs. It doesn't have their name on it. So
That's
now
right.
they yeah, so in 2005,
Mm.
I started working with DRS back in the 90s, going as a volunteer. I had no contracts, I had no grants. I was a volunteer trying
Mm.
to make a difference with these young people. I was one. I'm coming from Southeast. I've been there, done that. So I go and volunteer with, and I'm also a disabled veteran. So
Mm.
because I got hurt when I was
Mm.
in the military. So
Yeah.
so I'm trying to give back. And
Mm.
2005, I was in a meeting and they were having a new director come in, a white boy named Vinny Schiraldi. I'm gonna show his name. I'm gonna shout his name out. Vinny Schiraldi. He comes to talk about he's coming to save the black kids. So I'm in the meeting. Number of people was in the meeting. Some well-known folks was in the meeting. So
Mm.
we all listening. We listening to his plan. What he's planning to do to save our kids. So I'm listening.
Okay.
And I stood up in the meeting and I said, wait a minute, hold up. I said, that's not gonna work. I said, that's not gonna work what you're trying to do. And it was the other people, black folks, who stood up. Mama Joe was there, she know. They gonna say to me in the meeting, oh, Reverend Miley, give him a chance. And I said, the hell you gonna give him a chance over my children's dead bodies? And I got on, walked out. And a couple of other people walked out with me. And I said, that's
Mm.
2005.
Wow.
Because what they were planning to do was to take the kids who come out of Mount Olivet Road. Okay, so you
Mm.
get arrested. They take them to
Mm-hmm.
Mount Olivet Road, and all they
Mm-hmm.
do is they triage them there, and then they send them
Mm.
to Oak Hill, and then they don't give them the kind of mental health and other kinds of support services. And the only thing they wanted to do was to put them in school. So they say, well, we've done a good thing because they can learn reading, writing, and arithmetic. Well, no. They need more than that. And
Mm-hmm.
so what I saw was this plan that they were planning. What they were going to do was to release the kids to third-party custody, where they would be housed in small community group homes in the community, and let the community support program give them the support. And that's why I walked out of that meeting, because I said that's not going to work. These
Mm.
kids are not ready for that. I don't care who you in. I don't care who you got them in charge. They don't. They're not going to do it. It's not going to work. So anyway, that was in 2005. So I said I would never do nothing with DYRS after that. I wasn't going to do anything with none of those community-based partners because they gave those third-party custodies to those community-based organizations. Well, 2010, March 30th, 2010, we're in a meeting. Mama Joe, we were at a juvenile court meeting with Judge Izzo or something like that from the Superior Court. We were over on V Street. All of us had we had phones, cell phones, and all that stuff. And I had created what was called the clergy response teams. We had clergy response. We had clergy that we trained them to respond to homicide scenes, to respond to communities that were having some trauma. So we had about 160 clergy and lay members trained under the auspices of the late Laverne Harley, and she was one of my ministers. And we created that. So we're in a meeting with the judge at V Street, and everybody get they beep beepers came on. Something happened at South Capitol Street. Everybody go to South Capitol Street. So I get up and I go to South Capitol Street. Now South Capitol Street is like this on my where my block where my office was worked at. My office was located. So I get to South Capitol Street that night, and it was all taped off. And Chief Lanier, she asked me, she said, Red Molly, can you go on the bus? She said, we have the families are on the bus. She said, can you go talk to the families? I said, of course. So I go up on the bus, and the families were all there. All of them, all those children that got killed, their families were on the bus.
My
So I'm standing
goodness.
there and I'm talking
Wait,
to the
what bus?
family.
What bus is that?
It
The
was
bus where
they were on a metro bus. See that what they had done, they couldn't they had taped off South Capitol from Atlantic Street down to South Capitol Street. So
Okay.
nobody could go down. So what they took a metro bus, and stopped it up there and opened it up. And it was March and it was kind of chilly. And so the chief said, I'm gonna let the families go up there and wait. So because no family didn't know what was going on. The kids were
Right.
down there, the kids shot up and dead. The families now, they got the families on the bus. So they asked me, Lanier asked me if I go up on the bus with the families. So that's what I did. That's my duty. That's my duty as a pastor. So I
Right.
go in, and I'm trying to do as best I can because I don't know all of what has gone on. I know that we got children that shot. We don't know the extent of it. We don't know, who's dead. We don't know how wounded. We don't know any of that other than the fact that the chief said, Brett Molly, we go up there on that bus and talk to those parents right now. So then I'm on the bus talking to the parents, and somebody comes up to the door and hollers at Miss Jeffries and tells her daughter is dead. And she runs off the bus, runs past me, and I ran behind her. And the Washington Post caught a picture of me kneeling over her, and you can see that in the post. I'm kneeling over her because she couldn't go no further. They had stopped her. They couldn't go. She couldn't go but so far. So anyway, I continued to minister to the families, and then I said to the families, I said, you all can come to my office because my office was like right down the street from where this happened. And I said, you can come to my office at any time, and we can continue this conversation. We can see whatever we need to do. So the not the so that next day, all of it we went out. Everybody went to the scene. I saw some of the parents there, and I told them again. I said, "You all can come to my office," and they agreed. So I set that date and the time. for them to show up at my office. And they came, and we began to process what we were experiencing, what each one of them individually had been going through dealing with that situation. And as I listened to those parents and the cries of the fathers and the mothers and the grandparents, I said to them, I said, we got to do something better than this. I said, what can we do different? And the Lord spoke to me, and he said, we need to have a city council hearing because this is not right. And then
Mm.
what happened was, later on that day, I began to get more information about the kids who participated in the shootings. And come to find out that the ones that did the shooting, they came out of DYRS
Oh my
third party
gosh.
custody. They
It
were
came
with
full
they,
circle. My goodness.
from two. Remember now, 2005. I told them it
You
wasn't
just,
gonna be
yeah. Those kids were the
2005.
kids that were failed by whatever was going. Oh my
Yeah, come
goodness.
on now.
Oh my
So
goodness.
when we talked to the parents and I told them what I was finding out in terms of information, and I was telling them, I'm gonna tell it to everybody. This is what happened. So the parents said, well, what do you want to do? I said, let me call my council members. I called Marion Barry. I said, Marion, I said, we need to have a hearing. And he said, well, go to Phil Mendelson and asked him, because Phil Mendelson was the chairman of the judiciary at the time. He's now the chairman of the council. So he was the chairman of the judiciary. So I said to him, I caught him in the hallway. I said,
Mm.
that's what you got to do. Sometimes you just got to get up in there. A phone
Right.
call won't do it. A text won't do it. An email won't do it. You
A
got to
tweet.
go. A tweet won't do it. You got to go up in there. So I
Hmm.
saw him on the hallway, and I said, Councilmember Mendelson, I said, we got a problem. So I told him what I had experienced on South Capitol Street. And I said, these parents and grandparents, they want to talk to you. I said, because they don't understand how is it that DYRS allowed this to happen. He said, well, what do you suggest that we do? I said, have a hearing. I said, have a hearing, bring the parents in, they'll come and talk to you, and then you can listen to them, So he agreed to do it. He did it. And so we went, we had the hearing, parents came, we talked. So a couple other council members came and listened. So after that day, I get a phone call from David Catania, who was the council member who was the chair of the health committee. And so he called me and he said, first of all, thank you for doing what you did. He said, what I heard, he said, this sounds like this is something that I need to have a hearing about on my committee, the health committee. He said, because it sounds like a mental health issue. I said, you're right. I said, these kids that came and did the shooting, a lot of them have some long standing issues that have never really been addressed. I said, so, what can you do? So he had a hearing, David Catania, and we brought the parents over. And then after that meeting, after that hearing, he called, he said, I want you to bring a couple of parents and I want you to meet some lawyers. He said, we're going to craft this legislation. He said, we're going to have to address this. I said, okay. So we got in the car and we met with the lawyers on K Street. These were some K Street lawyers. And we sat down with them and crafted and in the hours of drafting that legislation. And then we came back and then we looked at the what do you call it, the revisions. We were able to look at the revisions and then make some make some edit revisions,
Right.
and so we did all that, got it done, and submitted it. And Miss Jeffries became the face of this, because she was willing to speak truth to power. She didn't have no cut card, and so she was willing to be the face of for these families, and that's how we got the legislation pushed through the council. And we
So,
yeah
Reverend Motley, can you please help me help all of us as we were talking about it a bit as to how so the assailants, the people who the young people who killed who were in DYRS, as you mentioned, that committed those acts of violence on that day, um, they weren't in school. So how they weren't students in school. So how did it become critical to have a school-based mental health program because of what happened? I know Michelle Jones was a student and possibly some of the other young people that were killed that day, but not everyone was a student. So what do you think of that, and why school-based mental health?
yeah. One of the things that we recognize, all of the ones that did the shooting, not all of them were with DYRS. The main ones, there's two brothers who were involved in that shooting, who were the ring leaders, and who were tied to the DYRS system. Um,
Mhm.
Now, in terms of the school based, we understood that if we were to address this issue of of child trauma and mental health issues and all of that, we had to go from cradle to 21. We had to figure it out. Okay, look at what's going on. What have we experienced? The years of our experience, the things that we've done. Remember now, I started doing some work in DYRS back in 1991, and going in there and ministering to the young people, and finding out that a lot of them had trauma. They had trauma. They had family issues. They had father issues. You know, mother issues. They had a whole bunch of stuff going on that really wasn't being addressed. And
Mhm.
so when we looked at when we were drafting the legislation, we said, okay, this is what we have to do. We have to look at this from cradle to 21, and everything that we need to do to address it. And we need everybody who is supposed to be making a difference in the lives of these young people should be at the table. And so we said we need to bring DYRS, we need to bring in DCPS, we need to bring in DHS, we need to bring in the mental health people. Everybody needs to be a part of this solution. Public housing people, everybody needs to be part of this. What do you call it? Uh, what do you call it when you say
Comprehensive, well, I think what they call it in the law is the comprehensive school-based mental health system that kind of bridges
yeah?
out into the community. Because right now, how it currently operates, and so I want to get your thoughts. And Mama Joe, please chime in. You participate on the
Hey,
coordinating council. You're part of the cohort. You've been part of this history. So, and I'm just so honored to meet you, Robert Motley. And I'm going to keep you close because you're such a wealth of knowledge and skills. Because even I don't have these skills. I did not study. I'm a political scientist, and so I'm trying to
okay,
figure out light. I'm trying to figure out camera, all these things. So you got mass communication in your tool shed, and we definitely want to keep creating content that's useful for our community, especially community impacted by Black and Brown disabled folk, and people raising disabled folk, or have disabled folks in their families, and you're an asset, just to say that, and thank you for your time and your commitment. And so back to the law though, right? Like, so I got involved in 2017. I was appointed to to the task force. And the reason why they had a task force in 2017, because that's how Capitol Street Memorial Act, which has 5 parts, enlists DYRS, and that's the Department of Youth Rehabilitation Services. For those who may not know what DYRS stands for, that's juvenile justice, juvenile detention here in the District of Columbia. And it also enlists child welfare, CFSA, Children and Family Services. It enlists then called Department of Mental Health, now called Department of Behavioral Health. And even as we're calling it school-based mental health, that's only the popular language. The governmental language for it is school-based behavioral health. That's why we're the Behavioral Health Coordinating Council. And so when that in 2017, the law said that every school, every DC public and DC public charter school is supposed to have, an implemented some school-based mental health system, right? But that did not happen by 2017. And there were lots of social workers at that time, and school psychologists that were part of the unions connected to DBH who were protesting and saying that the children deserve better and the program needs to run better, because at that point, the family services organizations were not being dependable with the schools. The schools were losing trust. Principals didn't want to go into partnerships with them, and the program was falling apart. And so they called together a task force to say, how can we rectify this? How can we get everybody into the schools? But I mean, it remains an imperfect process. To this day, we still don't have school-based clinicians, which is kind of what their goal was at that time. But I'm not I know we need clinicians for crisis care, but I think that's such a trap. ACLU has a crisis response coalition to talk about how can we make this more community focused? How can we not, open the door to police brutality and other things that can happen to people, particularly our children, in those kinds of instances. So, but I believe all these years and through the Acoma Project, which I hope you're part of our launching in May, to talk about what has happened, what is happening, and what do we want to happen. One of the things we want to happen is to have peer support. We want mamas and caregivers like Salonda, Mama Joe, myself, yourself, to be able to come in, offer support, offer knowledge. The children don't know the story, Reverend Motley. They don't know your work. Many of them don't know you and can use you. You can be an asset, and we can all be an asset to our children in a way that I don't need to go get a master's in social work to be able to do that and become a mandated reporter. I mean, that's not the only way to help. And no, there are some great people who are committed that are in those fields, and I know some of them, but institutionally they don't work. So what are your thoughts now, considering we're going through another crime surge? We're going through another place where everybody's like, police, more, that's the only solution we have. And no one's talking about the children and what they actually need in their hearts and their minds and their bodies to be better and safer. So what do you think? Mama Joe, do you want to chime in on this one?
I thank you so much, Dr. C, and all the guests that are on here. But even when we talk about the school-based mental health coalition, and I'll just say 2017, but actually one of the first shootings was the young girl at the stop at Fingon, if you remember, Reverend Motley. And we brought in just what you're describing, Dr. C. We brought in 7 colleges, 20 community-based organizations, and we actually built a community approach to the school-based mental health. We have found out, I heard someone, I think it was Salonda, when she said a wrong name was on her son's report. We even, launched the investigation and got 100 evaluations and wiped the names out, and the content of every Black boy's evaluation was the same. So the school-based coordinating council and what they need to do in the schools, you heard Reverend Motley talk about the clergy and police task force. What I feel is what I've been hearing on here. all the time we can't use the condition. One mother said, she said, the doctor kept on trying to give me all this medicine. I just was getting ready to be evicted. I just needed some money to pay my rent. So
Right.
even
Exactly.
yeah, so even the new buzzword, I'm not going to say I'm scary to say this, but I think it's a movement because the dark and brown community generally does not utilize clinician and psychiatrists because we have a history of that too, being raped and all kinds of things after being sedated. So
Right.
all this history goes back to. So I feel, and the coordinating council, which you know, Dr. C, used to be 51% parents and families. Under this administration, everything is government run. The prevention. Look at the billions of dollars that are being put in. What was it? Building blocks. Now they changed it to the gun violence initiative. Now they changed it to the ones, and nothing is working because we come from a heritage of the village approach.
Yes.
The village approach. So when they talk about prevention, and some of my mothers tell me, say, Mama Joe, the police parked right here on the corner, and my son got shot right up the street. So, it's almost to me a form of genocide. And the South Capitol Street murder, parents started. The Advocacy for Family Court Act, families and parents started. Every initiative that has been put in place comes from a Solander who just homeschooled. Uh, I went into behavioral health because Miss Solander, they kept trying to do everything else to my son, put him out of school when they knew he couldn't hear. And one day, the white boy said to the teacher, he didn't cheat. He asked me a question. He can't, he has a delayed hearing and moderate loss of hearing. But again, if that white little boy did not say to that school, and then we end up filing cases. And Miss Londa, I know that, and all of y'all, I have had many days of crying. I was put out by post. I've had to call Reverend Motley to help me survive the good fight on many things. Even with my son, calling the police to escort me and Teresa Bolick out of the school because we are asking for questions. For all of that, the school-based mental health has to be run by parents, families, and community. A clinician should be only called when there's a crisis. And Matt Bill, Matt called me one day. He said, Mama Joe, I finished with this family. There's nothing else I can do with him. All her issues are social.
Yes.
But if he had not walked through the process with us in shaping Eason, he probably would have prescribed that child medicine, not realizing. I had to say, I'm not crazy, Miss Patterson. My mother and my father were killed in a car accident. Something don't take drugs. It takes loving on, caring on that Mama Chaoma, the Mama Salana, Mama Fari. This is the building of what our culture comes from. And our children are getting killed. And Rev, I'm not afraid to say it. It is genocide. That is
Hey,
what
Mama Joe, Mama Joe.
Yes.
You mentioned Ralph Neal. Let me tell you what Neal did. What Principal Neal did when my daughter was at Easton, and we were having challenges with her. You know what he did? He told me I'm gonna refer her to Judge Mary Terrell. He said we're gonna take her over to Hamilton.
Oh my
So
God.
he made a referral. He was the principal. He said, Rev, he said, we're gonna take her over to Dr. Mary. And she graduated. My daughter graduated. She's an entrepreneur. She has her own business. She does some work now. And she's the mother of my granddaughter that got killed last year. And that was
Oh
a car accident.
no.
That was a car
Oh
accident.
my.
And but what Mama Joe was saying, how the principal understood what my child was going through, and he told us to take. I'm gonna take her over to Judge, and she went to Hamilton. Remember, Hamilton was the alternative school, and that's where we put her, and she graduated. So you're right,
Yeah,
having a village.
you're right.
That's how we did it. That's how we
Ralph,
did it.
Ralph Neal was, what do you call it? Assistant superintendent. And
Yeah,
he went to the Spingarn school and stayed at that school, stepped down from that powerful position,
yeah,
and
yeah.
took
I
posture
remember.
to
That's
be
right.
over that school for a whole year. We transformed that school. And I think, Reverend Molly, there wasn't no more killings over there. They started a
Nope.
student
Mm.
march. The kids took control of reporting if it was a gun, because that was the first impact of a child. And she wasn't a target. They were just at the bus stop and some shooting started.
Mm-hmm.
And she
Mm-hmm.
was 9th or 10th grade. And
Mm.
Can I ask the
as
question?
Ev said, went over to that school and stayed a year, stepped down from that deputy superintendent and stayed over there until the school got community driven, not a whole bunch of clinicians in there putting medication on our children, foaming at the mouth, misdiagnosed.
That part. Okay, talk about that.
So, Rev,
Okay. So
I,
you have a question, Reverend?
Yeah, I had a question to Miss Thomas. Mrs. Thomas. A question. You homeschool. Does the DCPS pay you for supporting your child?
No.
So
Uh-uh.
the
We put that
question
in the
now
law.
is that,
Y'all ready to go for another law for that? we,
yeah,
we need it
because
on the
I have a
book.
question, Dr. Fee. Look, the question, because we know that, because see, we fought that budget. We dealt with that school budget years and years and years ago, and it was supposed to be, it was performance based, and then we said we would do it by school based, and it was per child. Now remember, now
Mm.
we said we have a budget that is per child driven. So if your child is a DC public school child, even though you're home school, shouldn't you get some allocation from DCPS to support your
Makes sense.
That does
Or
not
Ossie
happen.
or
invest
somebody.
dollars,
I
That
reinvest.
does
mean,
not
I think
happen.
it
The
just
only
speaks
thing
to
that
the disrespect. Sorry,
the
go ahead.
only thing that I got help with is that Ossie was willing to pay for his testing. But
that's all?
that in itself was like pulling teeth. And if they did offer any kind of services, there was always a catch. Oh, you can get these services, but once you get the services, we're going to need blah, 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 blah. So then you're not truly free to homeschool. Because I did a
Mhm.
lot of unschooling in my homeschooling. Like, okay, this is how y'all learn in school, but we're not gonna learn that way. We're gonna do stuff hands on. You know, I started with in I guess he was in first grade. I started teaching about the ancient history, and we made mummies. We went on field trips. I was a lot of hands on because I wanted to make sure I hit all of the points of the Howard Gardner learning styles. Is
Mhm.
it spatial learning? Is it auditory? Kinetic? I was doing all those type of things with him. So any kind of help I got from the school always had some kind of, we're going to help you, but you got to do this. And so that was the thing that a lot of the parents, our non-Black and brown parents, were like, no, we don't want the government telling us how we're going to homeschool. So therefore, we don't want to have this particular thing in the law. So there was a lot of things that were poured out because they
Mm,
did not want that interference from DCPS.
I
Okay.
And
see.
so not having
Okay.
that from DCPS meant that, okay, so if you're not going to use that, then we're not going to help you with this. And so it was
Mhm.
like, okay, so this is where I am. But like I said, the
Okay.
only thing they would do out an issue is testing. But
So
beyond the
do you see,
testing, you was on your own.
right,
Like to
beyond
get
testing?
special, get like speech therapy, OT,
Mhm.
that was dependent on you
So maybe that's
after you got
something
the
that
results from the
we
testing.
maybe that's something we can advocate for, because as long as you need a specialty, if there's a specialty, you know, then
Yeah.
DCPS should be able to cover a specialty that's needed. Once you, yeah.
Yeah. So I think there's even more layers. So I know it's 7:31 right now. So I want to maybe for the caregivers that are watching this and are watching this as part of being part of the boot camp. I mean, I'm hoping if I have you all's permission, can we go for another 15, 20 minutes? And if not, let me know if that doesn't work. Well for you, and others, if you got to hop off, great, you'll be able to tune. Thank you. You're able to tune in later. This is always going to be available on YouTube, at the very least. But one of the things that at least last year, this is our second year of having a boot camp. We had Louis Bossing come here from the Bazelon Center for Mental Health to also let us know that they were forward in a lawsuit because of our kids that were being psychiatrically placed out of state. And a big concern is like my children attend non-public schools. They attend Shepherd Pratt in Rockville. Many kids go out of state, in Maryland and Virginia, for their private school paid for by the public school. We have students that are being homeschooled. We have others that may be in DYRS or other prison facilities. And school based, the current vision of the law, even in birth to three early child development centers, right, there's so many locations where school-based or mental health services and support in a non-carceral way, in a way, and I think that's maybe what the homeschooling parents are. They don't want this heavy hand controlling what they want to do, but they also want to succeed and have the support to succeed and the tools to succeed. So, what do you think, Reverend Motley, Mama Joe, Mama Salonda, I'm just throwing on a mama to you too. We are mamas, right? Like how do we how do we begin to think about other locations in which mental health services can be offered, knowing that we don't want problems coming to us in those. We don't want any more problems. We want a better system that doesn't require, trigger our traumas from the past, historic traumas around child removal from the home, or going to prison, or ending up in juvenile. I mean, if you're already in juvenile detention, what is your way to feel like you have a future in there and that you have something to hold on to? So what do you think about mental health in with young people who are school aged but are not in the public school system? What about them?
Well, I think the main issue for me is that everyone wants to pass the buck. It's like, so who is responsible? Like right now with my son, my youngest, who has Down syndrome with autistic tendencies. Right now we're going through this thing where because they typically are not done with school until like 22, 23. Then you have your school services, but if he's getting speech at school, is the insurance, now the insurance wants to know if he's getting speech at school, then we don't need speech outside of school. So you have to fight to get the outside service because the speech in school is not sufficient. And so now that he's at a certain age and he's transitioned into DDS, into the more adult services. So now DDS is looking at, well, is he getting this on the medical side? Because if he's getting this on the medical side, we're not going to give it to him on this side, which means sometimes he's getting on the medical side. Like right now he's getting one of his behavior things on the medical side. But we know it's not enough hours. And DDS knows it's not ours, but because he's getting on the medical side, so DDS is not going to give it to him. And I think that happens a lot. So it's like no one really wants to take responsibility, so the can keeps getting kicked down the road because he's too old for this, or no, this services can be done in school, therefore we're not going to worry about hitting into the insurance. Oh no, we're not going to do it because school is responsible. So then it's like no one takes responsibility, and then your child is sitting there just floating because no one wants to take responsibility. And that has been something that I've had to fight a lot as well, because school don't want to do it, and then on the other side they don't want to do it either. So it's like it's like everybody have the money, like it's money there, and they have the services, but it's like you're gonna have to jump through these loops to get it. because
Yeah, so it looks like
medically
that's
he's
maybe
supposed.
something we can do something about. I mean,
Right.
we're talking
So
about
I think
public
it needs to
policy.
be clear cut. What are the policies? Like at this age, we can't say no because he's getting something on the medical side, because it might not be enough on the medical side.
Mm,
Things could be a medical issue, but it could also be a social behavior issue that needs to be done in his community. Like there are things I'm trying to get done for my son that it will be community services, because when he's out in the community, he's responding in such a way based on his sensory issues. And so that's not on the medical. He's not doing it on the medical side. He's doing the community side. So why you guys keep trying to tell me get it through the medical? And my medical insurance is like, no, according to his criteria, he doesn't meet it medically. So go back to, so I've been going back and forth between DDS and his medical stuff. And I think that fight right there, a lot of parents, if you're not someone who's going to sit there and fight, you're going to get frustrated and say, forget it. And I think that's what a lot of parents do. They say, forget it. And then our kids end up falling through the cracks. And then
that's
they're
right.
like, well, why are they out in society? It's like, well, when you had the chance to really get in and help that parent when they were crying out for help, you passed the buck. So now this is the outcome. We have, like you said, shootings and everything is up. It's like, and it's the young kids. It's not like every time you hear about a carjacking, it's some 12-year-old.
It's
Like,
a third.
I'm
That's
like, what
right.
is,
It's a
it's like
little one.
it's
Yeah,
like they're starting younger
yeah,
and younger. I think about that
yeah.
one kid that was 6-year-old that shot the teacher. 6 years
Right,
old.
But
I
that
mean,
right.
they say he's
it,
not getting charged because he was, I'm assuming he was special needs, but still,
but
like
Yeah.
also
there was warnings in the
It's
school.
still
He said that he
happening,
was sick.
right?
Right.
Yeah.
but
And
also
he
consider what
showed
that teacher
he was having issues in
kill
school
her.
and no one addressed it. That's the
What
thing from my
about
understanding as
what
well.
about,
He said stuff.
what about the climate? Because I know from all of us working in this special ed movement, a lot of teachers tried to be very cruel and mean to my son.
Yes.
So
Yeah.
the first thing that came to my mind when that happened was, how did that teacher present herself to that child for him to
Mm.
Right.
Right. What
do
happened?
A lot of
What are the
educators are not
antecedents?
educated.
They like to
that's
say,
right.
what happened before? Right. They
Right.
always talk
Right.
about the
Right.
kid is violent, the kid did this, they don't talk about what they did to
What
talk the
triggered
child
them?
or what triggered
What
Uh,
them,
triggered them?
right?
Yeah. Because our
teachers,
educators are not truly educated. They're only,
well,
it's
they
like
don't
you
have
get,
skills. I
you're
think the biggest
pinpointing
part,
on one thing, where they're not educated to treat an individual. They're educated to treat a curriculum. They don't look at the students as an individual. This is what I'm supposed to teach. This is what's on this curriculum. This is what the standards are. I'm going to teach these standards.
I
I'm
think
not
it's
looking at their learning
skills.
style. Gone are the
Uh,
teachers who think about a student's learning style. Gone are the teachers who sit back and go, okay, I know I'm going to teach this lesson. So let's look at this and do a Venn diagram and find out what are different ways I can teach this one lesson that will affect all my students and have them all participate. That doesn't happen anymore. Teachers are stressed out, overworked. That's not happening anymore. So you get what you get in a lot of these schools.
but it's no human
People are not going
skills.
into the teaching
I,
field. I mean, they're lacking. We're short of teachers right now. Nurses
no,
and
Yeah,
it's
we're
teachers,
short
human
of
those are two
everything.
skills.
professions. Yeah.
I think it's human skills
Yes,
because
it
even
is.
the
What do you
dumbest
mean by human
person,
skills?
when I say
What do you mean
human
by human
skills,
skills?
when I say human skills, there's a lot of institutional intellectual learned privilege that has nothing to do with what people need or what services need to be delivered.
Right.
Okay, we have look at you, for instance, Dr. C. You're skilled and went to institutional intellectual learning, but you're not doing it in privilege. You're not thinking
Right,
that you're better. So the
right.
whole bottom line is, even a person that can't read and write no kindness. And when I say
That's right.
human skills is, our children are hurting because a teacher saying, "Go and stand your stupid self." What I never we got a teacher fired because the teacher said in front of the class, "Where are you going to visit your father in jail?" That's what I mean by human skills.
Mm.
Hmm.
Yes.
Human
Yeah,
skills are
emotional.
hurting.
I understand that as emotional intelligence too, right? Like
Yes.
knowing
Yes.
how to
Hmm.
just show up. So I think one last thing, and then I think we're gonna call it a night. So Nina, can you roll the intro and then give us clip 3, if you can do that, please. And I want you guys to comment on this, on what happened at the over.
Police around schools, just to name a few. Welcome to the revolution. It begins with you. Fannie Lou, Heyman Tie. When it comes to this shit, 1, 2, 3, 4. We sick of the bullshit. 1, 2, 3, 4. We sick of the bullshit. 1, 2, 3, 4. Sick of the bullshit. We sick of the bullshit. 1, 2, 3, 4. Sick of the
Okay, that was Mama Fari's voice, and you know, we try to use it as a transition to do our new stuff. Maybe we'll find a smoother way to do it. We need Reverend Motley's you know, electronic media skills here. But there's a clip that this was to come. So Nina, can you play that? That's the actual clip. So we switch a segment and we're going to a clip. I hope it works. Do you want me to try and share mine, Nina? Can you say in the chat what's going on? Are you trying to find it?
Reverend Motley had to hop off.
Yeah, I remember he said he had a meeting at 7 something. He said that earlier tonight. I'm gonna try and share my screen if Nina's not able to. It's at 1:25. Okay, so let me see if this works. Can you? I wonder if you can add present video file desktop. Yeah, well, maybe that's not going to happen. We got to figure out the technology on this. There is a clip from the oversight hearing, so perhaps by next week we'll figure it out, or I'll do like an ad hoc. I've been trying to say I'm going to come on, and maybe I'll do it on Zoom instead, to just do a brief like overview of the oversight, the education oversight hearing. Essentially, they were talking about Councilmember Robert White was asking DCPS Chancellor Louis Farabee about first about school-based mental health, about, you know, resources that every school doesn't have a clinician. What's the plan? And then his response to me, which was, you know, sick of the, you know, we're sick of the BS. We're sick of the BS. That's how I feel about that, his response to that. And then there was the question about SROs. So school resource officers, you know, that seems to be the knee-jerk response as to what they're trying to do to address the rising concerns. And this is principals calling for this, of which we've spent years trying to create. Oh, you got it, Nina? You got it. Okay, so go ahead. Just go ahead and pull it up if you can do it. And just, you know, I'll stop talking and as soon as the video comes up, of course. But, you know, essentially we just want to gauge an understanding about, like, you know, why is the knee jerk always about somebody with a gun, a weapon, a strong arm that can physically harm our children to be how we solve public safety when it concerns our children and our youth? So, I mean, I don't know. Why do we do that?
Because I'm still looking at it as genocide, because you just answered your question when you said young people. Our young people are dying. Our young people are doing these acts. And it appears ever since they legalized marijuana, and that marijuana that they're giving to our kids is chemicals all on it.
Yeah, that K2 stuff is deadly.
It's something bigger than all the advocacy in the world that we can do. And I will say systemic failure. I will say that they're not really trying to save our children. I think it's to a point where, just like the mother Thomas, she decided to take her kids out of school and homeschool.
Our kids
It's
are viewed as
yeah,
kids. First of all, our kids are not viewed as children.
That's
right.
right. If they have, and by if
Right.
they have
That's right.
disabilities, right? Like they, yeah, yeah.
They're viewed as adults.
Disabilities are
Like,
Oh, our black
manifested.
yeah,
children. Yeah, our
yeah,
black children are just,
are not
yeah,
viewed
our
as
black
kids. They're viewed as
boys,
adults. So
especially the
they're not
boys.
treated
Yeah.
as,
But the girls
like
too.
you would not have you would. I have yet to go to any school that is predominantly, a PDI school, predominantly white elementary school, to see resource officers in there.
Mm.
Like
Well, I
that is
tell
never
you,
mentioned.
Well, so we got this clip
Sally,
up. So I want you guys,
Sally and Molly's going to get all the therapy they need at the school.
can you guys hang on and respond to the
Mm-hmm.
clip,
Go
and
ahead.
then we'll I really I want to get your live response. Okay, go ahead, Nina.
For being here, for the work that you and your team are doing. I want to start with mental health and wellness. We've
Turn up the volume.
implemented the
Is that as
school-based
loud?
behavioral health program, but we're still hearing about continued needs for more services. Educators and mental health professionals are overwhelmed and feeling burnt out. What kind of mental and behavioral health wellness initiatives currently exist for educators in DC public schools?
Yeah, thank you, Councilman White, for the affirmation. Also raising an important challenge that, the trauma that impacts both our students and our educators. We've seen certainly a dramatic increase in the call for those types of services. You mentioned our school-based mental health model. That model primarily serves students. We're proud that we're able to offer that in all of our schools, but as highlighted earlier, we still are challenged with the national shortage with clinicians. But DCPS has a robust educator wellness toolkit that we've developed that supports schools in creating a culture around wellness. We also have specific groups of affinity that staff participate in, and for example, recently participated in a males of color yoga session around wellness. And then we also have, in addition to that toolkit, created a number of activities that staff can participate to either reduce stress, to self-assess, and then we also have a number of mental health supports available as well. Primarily in schools, though, we primarily around psychologists, social workers, Department of Behavioral Health clinicians, and then the community-based organizations that support our schools as well, in addition to our counselors.
Oh, and those are for teachers or students?
So primarily those services are for our students, but we do have services available for staff. And then as a part of our benefits package, we do offer the ability for staff to schedule time with clinicians outside of work time to receive additional support if they deem that necessary.
Oh, that's great. That's available to all staff or just some?
Correct. That's available to all staff.
Excellent. And who organizes and leads these mental health initiatives for professional staff?
Yeah, so as a part of what we do for our staff, that is a part of our employee assistance program. We also have what we call the Educator Wellness Center. This is again something that's focused on prevention and it's a little bit more self-guided that allows the individual to assess themselves and also connect to on-demand content as relates to how to best support their mental health. Then we have similar work that happens with our schools, which includes our school-based work, but then we also have our trauma prevention and response team that provides an additional layer of support as well when a school is experiencing a crisis. So, for example, if a school has a situation where a student or a staff member is impacted and there's a need for crisis response, that team will respond as needed.
And what are your thoughts on there being a coordinator to facilitate these types of activities in DCPS central office?
Yeah, so we do have coordination that exists currently. That team is led by Dr. Bryant Mallory and also Dr. Brenda Elliott. And they do, from my vantage point, a strong job with collaborating with Department of Behavioral Health. And they also support our school leaders as well and any resources that they need. And schools um, certainly have the ability to reach out directly to that team if there's a need for additional supports.
Okay. I want to chat about school resource officers. I think everybody here believes we have got to keep students and school staff safe, and that has to be our goal. In your testimony, you said school resource officers play a crucial role in our schools. To support that, you said they know our students and they play a role in response to violence. Let me start by understanding. So there are 27 school resource officers. Yeah, I heard in your response conversation with Councilmember Parker. Does that represent a decline? Have you started phasing out the school resource officers?
Yeah, so let me provide greater clarity. So I believe Councilmember was asking about officers that are employed by DCPS. So just want to be sure that like there is a DCPS force, and then I think there was a question about our contracted staff. So we have contracted security of a number of, I believe it's 350, and then we have 54 MPD SROs, and then we have 23 DCPS police officers.
Okay, very helpful. And is that a decline, or has the phasing out started at this point?
Yes, so the phasing out of the SROs is in process. And so we will see as we go into the 23-24 school year, another phase down of school resource officers.
So there are 54 now. How many were there before the phase out?
I have to get our team to get that number for you. So
if you could jump in when they send it to you,
okay.
I'd appreciate it. What's the difference between the role that what's the difference between DCPS officers and school resource officers?
School resource officers are more of an extension of MPD. And I also believe that the training is very unique and different as well. We have DCPS police officers, but they're trained as officers. And our SROs, again, have a specific focus on relationship building because they are primarily in the building every day. So, for example, the DCPS officers, they may be spread across several schools and it's a call and response scenario, or there's security for a game.
So
But a
before,
school resource officer is dedicated to that specific building and they're in that building every day, connecting with students and staff.
okay, and why can't the contract security, DCPS, police, or somebody else be in schools every day? And why does it have to be school resource officers?
Well, I think, there are critical roles that the contract security plays, right? And there, I think, is a separate set of roles and responsibility that our MPD SRO plays. And I think, trying to conflate the two, obviously, one is not a trained officer, one doesn't have intel as relates to, crime and violence in the city or proactive approaches. And then I think, the training is also very different. And so I don't want to, imply that we could just simply say to our contract security, you take on the role of what school resource officers have been doing.
So what kind of violence what's an example of violence that requires a school resource officer as opposed to a contract officer or a DCPS officer?
I wouldn't say the violence. I would say the type of interaction and connectivity we have with what's happening in the community and the neighborhood. So, for example, let's say unfortunately, there was a shooting in the neighborhood, or there's currently an active shooter in the neighborhood, or there's a report of a weapon on a near campus. That would be a response that would be more appropriate for a school resource officer. When we start to think about crime
The
or
school resource officer isn't going to leave the school and go look into a gun threat in the neighborhood, are they?
no, but they have intel and communication directly with MPD that can inform what happens on the campus.
And it's not possible for anybody else to contact DCP, MPD.
Well, it's possible, but I think that's not the way. I don't think it's the most effective and efficient way. So, for example, if you don't have a school resource officer, it may be somebody on the school administrative team trying to reach out to DCPS or reach out to police. And so I think, in these scenarios,
which is what happens everywhere, right? So, I mean, if it doesn't, if something happens outside my house, outside, any other building, apartment building, we call in the police. So that system doesn't work for schools.
I would say when you think about your home and you think about, campuses where we have thousands of young people, I just think they're just different scenarios in the policing structure. In terms
No school
of
has thousands of young people.
where you live, your district. There's a specific strategy to ensure that there's coverage should there be an incident. I think the activities that we see around schools and in neighborhoods near schools, there's certainly a value add of having a school resource officer, but I also want to go back to the relationship. Is that if, there's a gang related activity and there's a potential for some students in the school to be involved or engaged or being impacted, a school resource officer has much more leverage in intervening and the ability to intervene quicker, I would say, in regards to some of the other strategies. And I don't think that school resource officer, that strategy was or is unique to DCPS. There are school resource officers nationally around public schools. And I think that nationally, we've seen that their relationship and their ability to be involved has been really helpful. But to get back to your question, at our peak, we had.
Okay. All right. So, our night is I want to give you guys a minute or two to kind of respond to that. Thank you, Nina. Can you take down the screen? Just what are your first thoughts? We can unpack it more on Monday. We'll continue to unpack many aspects of this, especially when we have the Police Free Schools Coalition folk join us, later on this month. But, what are your thoughts? What's this got to do? What are your initial thoughts? You on mute.
Okay. So are you saying that there is a school resource officer and then there is a contractor and also DCPS is patrolling the schools? So you have three.
And the social workers that are mandated reporters, right?
Okay.
But
there's a lot of people. There's a lot of bodies. Let's just say that.
I think mandated reporting needs to be refined, and we can talk to Rev about that, because there's certain situations that don't really call for mandating reporting. And I say that because years ago we used to it was Bring a Parent then before it was Parent Watch, because we had a substance abuse problem. But we had a 90-day retreat process where we would help the parents and help them pull themselves together. Then if the parent did not get themselves where they needed to be, then we have fulfilled our responsibility. Then CFSA or someone can do removals, I think that we need to consider doing real hands-on crisis intervention to support that parent or support that family member, because sometimes it could be just one little thing that triggered the situation, or triggered the problem, and they get the right support, they're survive. I've seen it many times in the work that we have done by doing crisis intervention work with a family member or a family person. You know, I, all mandating reporting does not have to happen. Let's see what we can do in terms of healing and
Right.
doing crisis intervention.
I know, like when my son was in school, I remember him getting sick and me asking about the nurse, and I was told, well, she wasn't at the school today because she was in charge of 4 schools. So you had one nurse in charge of 4 schools, but then you have, and that's for the health of your students, but you have 3 individuals policing one school. I mean, like, where is the part? So it's more important for us to have the policing of the school than our kids' health to be taken care of. Because that's crazy to have, like I said, to have the resource officer, the contractor, and the DC
And
police.
and how many of these people have weapons on them in the
Yeah,
school
Yeah.
premises,
yeah,
right? And what discretion do they have to use those weapons in the schools, right? Like that's I'm concerned about that too, right? Like if there's an incident and we know the cops can kill our kids in the street anytime, if they're given that same authority in the schools, I don't know, it's just a lot. It's a lot to
And then there's
unpack.
the training that's not there with a lot of these policing. You're dealing with young minds. They're going to respond different than an adult, and so a lot of these policing officers, they're used to dealing with adults. I remember when one time I saw an incident on a school bus, and they ended up calling the police for my son's behavior on the school bus. And the police officer did not understand that this was a child. He knew it was a child special needs because DC, anybody on a DC school bus is special needs because that's the only one that gets DC, school bus
Well,
transportation.
so just y'all know that in March 21, Aussie DOT called the cops on my then 6-year-old son because he wouldn't wear a mask. And I had it
Yeah,
on. I have it on video.
that's
We could
basically
play that. We
similar.
could play that
Yeah,
the next
similar.
time, right? Still
Yeah,
have a
yeah,
human rights
similar.
case open about that.
yeah.
So again, it's I don't feel safe. I don't feel safer. I don't know
No,
So more to talk. Is that our approach to wellness? Is that our approach to crime?
policing.
People are
Hmm.
poor. People can't feed their families. That's why they're committing crimes. That's why they're sending their kids out here, to go get money wherever they can get it because they're
Hmm.
starving and they can't house themselves and don't have I mean, there's so many things that are lacking, unmet needs. But in the
And we're
interest of
spending on
time,
policing, and DCPS is spending on policing
that's right. I
instead
want
of
to
having
thank you all.
resources to help.
We had a series of time when they were handcuffing our kids, and Parent Watch we fought that to the whip of a whip, handcuffing I mean, small children, expelling 2-year-old kids from daycare.
Still happening.
We
Still
keep on
happening.
being trained. It's I just feel we got to go back to the basics. The
Yes.
basics. Just
Yes.
you know, I remember my fifth grade teacher today, because when I was very sick, she came to see me. So I just think human skills, I think that a lot of these behaviors for our children is a manifestation of systemic failure, lack of training. But even if a teacher is not brilliant or smart, kindness will help my child survive.
Yes. Kindness. Kindness is a fundamental thing that is missing everywhere. I mean, well, yeah. I want to leave an up note. I
Yes,
just want to thank you all, for your brilliance. I'm just so grateful to know so much more about you, Mama Salanda. I've heard, I mean, you are a legend in these streets. Mama Joe, you are a legend. I got the legends tonight, right? And your commitment even to this process of the boot camp, really honored. And we have a lot of work to do. We have so much to do with each other as families that are knowing that our voices are not being heard. Like, more and more people keep talking about family engagement, but nobody's actually engaging us or actually giving us the place to have a relationship, right? And to feed your families doing it, that part. And so let's just, I look forward to Monday. Let's decompress and think more internally with the rest of the cohort, what our next steps are. We do have a week of action. We ask cohort members, please put on your creative hats. What kind of demonstrative action do we want to send to the city, to this great, great, great city of Washington, D.C., that we're here, that our children are here, and that you can't, nothing about us without us,
That's
right?
right. It'd be
So
nice at the end of your boot camp this cycle if we could create an impact statement of our experience with these 6 weeks and let it be a publicized notice, but let the impact statement be. I've heard several things in this conversation where there should be some form of policy. And this school-based mental health, we really need to think of a way where we can include, it's not all about medication, it's not all about going into the head, it's also about, that's why we fought to have mental health change to behavior health. 90% of the dark and brown community is more behavioral health than it is mental health.
well, we'll talk about the difference on Monday and then come back
Yes.
next Friday and bring it to the community.
Yeah.
I want to
Yeah.
unpack that for sure. Thank you all so much.
God bless you so
All
much.
your loved ones, and thank you for your time. Want to thank our funders here, Diverse City Funds and Emergent Funds. Each cohort members will be receiving, some cohort members, we have a large cohort, and some will, and we hope to get more resources. So funders seeing what we're doing out here and like it, we want every one of our caregivers to be fortified, to be funded, to be cared for, to feel loved and respected and valued. And so that is our principle. I am self-critical that we don't have a sign language interpreter right now. We are working on the copies of this to have transcripts so people who are hearing impaired can at least read along. And as we continue to do fundraising, we hope that there are more opportunities to bring back our trusted sign language interpreters that were with us in December and moving forward. We know that is a huge value, and other ways that we can improve this and make this more disability accommodating, open to all your suggestions. Feel free to reach out to me on Cheborn Free on Twitter, anywhere else, on social media, wherever you're watching this, you'll probably link to a page that you can send a message. Please send a message if you have any accommodation concerns that we can do to make this better. Well, thank you all. Have a blessed weekend, and see you on Monday in the
See,
lab.
thank you. It was great, Ms. Thomas. It's very nice. Thank you.
Thank you. Thank you. This was great.
Thank you. Thank
Thank
you.
you.
Bye-bye.
Bye.